Hi everyone, this is Midwife Sally, and on today's show we are going to have a mom talk about her birth experience for us. Yes, so we are dedicating the show to letting women know what other women go through so that they can be encouraged and learn from the show. Yes, so today I have Madam Bibiana on the show. Welcome, Madam.
Thank you so much. Good morning, everybody.
Okay, hope you are doing well.
I'm well. Yourself?
I'm also fine. Yeah, so today, congratulations.
Thank you so much.
Yeah, so when did you have your baby?
I have two. The first ones are twins.
Wow.
And then the second one is a boy. The first ones are twins. They are boys, identical. And then the second one is a single baby. He was born in January. But the first ones were born in March 2020.
March 2020?
Yeah. Yeah, so they are five.
They are twins?
Yes, they are twins.
Did I hear, have you delivered twins like twice or?
Single, the first one, my firstborn.
Okay.
My firstborn. Yeah, okay. They are twins.
And
two boys. And the second one is a boy also. A single baby.
Oh, okay, that's nice.
Yeah.
And the second one, is that your current pregnancy, your current baby?
Yes, he's my current baby.
Okay, so that's about after 4 years.
Yes, almost 5.
Wow. So you spaced them, right?
I didn't mean to, but it just happened.
Does it mean that you had issues after the first one?
Yes, I did. Even with the first one, I had a lot of issues conceiving. It took me like 2 years, almost 3 years after marriage before I could conceive.
Wow. We thank God. We thank God he came through for you.
Oh yes, amen. He really did.
Yeah, so for every mom who is out there also watching, know that one day God will come through for you. Yes. So now let's come to your current birth. I want to, how did it go? How did your labor set in? How was the whole process? Can you tell us something?
It wasn't easy throughout the pregnancy. I was just always sick. A lot of infections, a lot of blood classes in my urine, a lot of glucose, a lot of leukocytes, which I know it's kind of common with pregnancy, but with mine, it was just too much.
Wow.
So with the first twins, I had a cesarean section, which was an emergency because I went into labor at 33 weeks, 4 days.
33 weeks?
4 days.
Oh, okay.
Yeah, I went into labor. So I was rushed into the theater to bring them out. And they also came with a lot of complications after their birth.
Complications? Is it complications, birth defects, or what kind of?
When they were born, the first twin couldn't breathe well. The second twin, I think his glucose level was also very low. So they were trying to manage them at where I give birth. That's at East Legon, Obatampa Women's Hospital.
Okay.
Yeah, but they didn't have a NICU also, even though there was a pediatrician in the theater. So immediately they had to get an ambulance to rush them to 37 NICU. They got to 37. They said the NICU was full up. So they had to proceed to Rage. And it was Rage my babies were admitted into the NICU, put in the incubator. And then later, Jaundice set in. When we got home, I was always indoors with them because it's just me and my husband. No help from anywhere.
Wow.
So I bath them. I do everything, even with my CS. Yes. So because we're always indoors and never stepped out with them, and because they were premature, they said we should stay indoors, and it was the COVID time.
Wow.
So one morning, I stood by the window and I realized that my babies were looking different. Then I prompted my husband. Even me being a nurse, I didn't really know much about jaundice, even though I've heard about it. But I was kind of like, their skin looks different. Let's go to the hospital. We got there and they said it was bad.
So it was the jaundice?
You said?
Jaundice, like when you went, it was jaundice? Yeah,
it was jaundice. And then they said we had stayed home for long, and then they had to put them in the highest light, which they call the fire flyer or something like that.
Okay. So the phototherapy, they have different levels?
You said?
The phototherapy, they have different levels, like that?
Yes, they have different levels of phototherapy. They have the one for normal, minimal jaundice, and they have one that if the jaundice is so into the body, they have another one that's higher. The doctor actually explained to us.
Oh, okay.
Yes,
Wow.
they said it's called the firefly or something like that. I remember the firefly or something like that.
Okay, so how are the kids now?
The kids growing up has also been a challenge for me as a mother, as a first-time mom to twins, and I have no knowledge about how to take care of babies, how their motor skills are developed, how to actually like help them with speech and all that. We have a speech delay issue with my twins.
Oh, okay. So they are
Yes,
4
they
or
have
to 5
speech
now.
delay. They are 5 now. They turned 5 last week Thursday.
Okay. So are they able to
Yes.
say mama?
Oh, for now, we are able to identify animals, colors, shapes, anything they are able to identify, even a car, a truck. But for them to have a two-way conversation with you, that's our problem now.
Oh, okay. So are they doing therapy or something?
Right now, we have started therapy. Initially, as a mom, there are some things when you hear about your children, you tell yourself no.
You do not
Instead of
accept it.
accepting it, you try to like shield and then like try to, I don't know how to put it, like you don't want to accept it.
I understand.
That's where I was placed. I didn't want to accept that they actually had a delay, and then one doctor was trying to diagnose them of DHA or something like that, and it was heartbreaking. I just walked out of the consulting room and I never went back to see the pediatrician anymore.
I understand. Wow. So were they able to tell you like what caused it? Was it a problem that happened around the birth, or it was a jaundice, or have they been able to pinpoint what could have triggered it?
Right now they are looking at how do I put it? They are looking at me not exposing the children to other children, me exposing the kids to early screen time, and also their premature death. That's the kind of things they are putting around them right now.
Oh, okay. Were you using screen to
Yes, as early as 6 months, or even before 6 months, I actually introduced my children to screen, which I think every parent should learn from my experience because it's tough. It's still tough. And I can tell you that even till today, if these boys were home, you would hear the second twin singing. He's always singing. When the first twin has picked up and can say, it's mommy water, mommy poop, mommy sleep.
Wow.
But the second twin is always singing. And I won't lie to you, as a mother, there are days I beat him up, like out of frustration, telling him that, Olali, stop. Olali, say water. Olali, say our poo-poo. Like, don't do this. And then he keeps doing the same thing. Stop singing. And it's frustrating.
You said he can sing.
He sings.
So the songs are, you hear the words clearly?
They are just rhymes.
The words of the song, they come out clearly?
Very clearly.
Wow.
Very clearly. If you give him screen, he'll watch and tell you what he's watching. But for him to be able to communicate, that is not the problem.
Wow. I think a little patience and therapy. Yeah, I remember just yesterday I went to my one of my brothers. Maybe when he's okay and he's able to tell the story, I would interview him too. I went to his house. He had a child who lacked oxygen at birth due to delay. And the doctor...
I think it's the same problem too.
The doctor said he's not going to speak, he's not going to do this, he's not going to do that. But immediately I entered their house, he'll be like, Auntie, you are welcome, with so much excitement. And I'm like, God, this is a child that they said he will never speak, he will never do this, he will never do that. So I believe that it's not easy, but with the therapy and all that, it will get better. It's not late. So don't give up. And if there's any therapy that they said you should go through, just a little patience and then go through. And as you said, it's not everything that you accept, but even if you do not accept it, like mentally, if there's any solution, you should go to. So now, do you expose them to kids? You're in school.
That's another reason. another big reason why we are changing them schools. The first school didn't help us. The second school changed last year. Is using screens to teach the kids. And because it's just my kids that I'm complaining about, they can't stop using the TV to teach the children. So right now we've decided that, and with their speech therapist effort, she says we should go to a regular school where their kids is just a blackboard.
Okay.
There's no. So now that's what we are doing now. We are taking them to another school next term.
Okay. That will be fine. I believe they would progress, and most of them, when they come out, they are very, very intelligent. Yeah, so just a little patience. I understand that it's tough. It means that, so what did you learn about jaundice in pregnancy? What is your experience? What would you say about it? Like a woman who has given birth and the child is having jaundice.
I learned that usually it has to do with the breastfeeding. It has to do, that's what I learned. It has to do with breastfeeding early. Okay. And then also giving the kids these, the non-endorsed ones. Because what the pediatrician told me was that I didn't breastfeed early, or the baby is not taking enough breast milk.
Wow. So mothers, if you are listening, enough breast milk. Okay. Yeah, so it was initiation of breastfeeding. So the moms who are listening, one of the emphasis of the conversation is to start breastfeeding as early as possible. And in case you see that your baby is having jaundice or yellowish discoloration of the eyes, you have to report to the hospital as soon as possible. Yeah. So do you think that the jaundice also played a role in their delay and all that, the premature?
I think it did. It did.
Wow. Okay.
Thank you.
Yes. We are praying that everything will be fine as soon as possible. Yes. So let's go to your current birth. Yes. How was it? With all your experience, what did you do differently?
So with my current birth, when I got pregnant, I was scared. I was scared in the sense that I was scared that I would have twins again. And I was scared that I would have to go through what I went through again. So I kept going for scans to be sure that it was just one.
Oh, so you have a fear of twins now?
I feel like I made a lot of mistakes as a first-time mom.
Okay.
Yes, I made a lot. I had an adult guiding me. I don't know. The mothers on the page, please, when you give birth, I don't know whether if you have auntie or somebody you can let come stay. I think it will help. But for me, when I gave birth, my husband's mom didn't come. She said she had a knee problem. It was just me, my husband. I had to bath my kid on my own. I had to do virtually everything. And then the little I learned from my late mom, what I was doing. So that was where the mistakes came in.
Oh, okay. Yes. Yeah, so at this point, I'll say that, a lot of midwives are online now. And, I would encourage, especially if you're a first-time mom, no matter what, reserve something for a pregnancy class. It's non-negotiable, okay? Even if the midwife does not teach the topic, once you are in the class and you need a specific information concerning that, you just go to the person. It's far better than reading around, listening to people. Sometimes the person can be old, but the person wouldn't have had your experience. Pregnancy is individualized. Your experience can be totally different from another person, and you usually need a professional who will tell you that this is the best, this is the best, this is the best, and it makes it easier. Yeah, I think it does make it easier. Yeah, so what was your experience with this birth? When you were going to give birth, how was it?
Yeah, so I went for my regular ANC checkup at the hospital to see my gynecologist.
Okay.
And when I got there, she had already booked me for a cesarean session on the Monday.
Okay.
So when I wasn't already feeling well. I was having this crampy feeling the whole week. Crampy feeling, kind of feeling dizzy. And then when I got there, my BP was high. I didn't even know my BP was high. And then usually when you go to Tampa Women's Hospital for ANC, they have this urine check, like everybody, most of the hospitals do it.
Yes.
So when I checked my urine, they realized I had 4 classes of blood. I had lymphocytes. I had glucose. Like,
wow.
The urine was just bad. So the doctor, the gynecologist told me that, can I go home and bring my bag? Because she can't let me go. She has to bring out the baby. And then I'd already psyched my mind that the baby was coming out on the Monday, not on the Thursday I had gone for the ANC. And then she kept telling me that she needs to do it on that same Thursday.
Okay.
So we went and got my bag, and then we went back to the hospital to prepare for the cesarean session. And I was so scared because I remember that with the twins, I was having that issue with the blood in the urine, the lymphocyte cells. I prayed that this baby too will come out, and then we would have issues. But thankfully, he came out, and then we didn't have issues. I rather was having difficulty in breathing.
Yeah.
I don't know why.
Because those things affect your organs, like all those things.
Yes.
It does affect you.
Yeah, I had difficulty in breathing. I don't know. I didn't know whether I was passing away or there was a different feeling with having this current baby. After the baby was born, I felt so different. I wasn't okay in the theater. I wasn't just okay. And I was trying to squeeze my husband's hand to like tell him that I'm not okay, but I couldn't even speak. I don't know what was actually happening to me. I was so filled with fear.
Yeah, so
But God made a way.
Wow. So how many days did you like regain yourself back?
I think on the 4th day.
Wow.
On the 4th day, I became better, and then baby became jaundice.
Again?
Yes.
Wow. But this time
it was
the baby came. But this time the baby came out. The baby. As of now, how is the baby?
37 weeks, 5 days.
So now the baby is okay.
Oh yes, he was placed in the light for just 24 hours, and then we were fine.
Okay, but I'm sure right now this one you took your breastfeeding more seriously.
I really did. Even when they were introducing naan to him, the baby was rejecting the naan. He kept vomiting anytime he was fed.
Okay.
So I had to go with the cookies, granola, oats, molly cocoa. I had to take a lot to make sure the breast started flowing. Then when he caught the breast milk, he became fine.
Wow. Yeah. So now the baby is fine.
Yes, he's fine.
Wow,
he's fine.
Thank God. How old is the baby now?
He's 8 weeks now.
8 weeks. Wow.
Yes. Apart from me realizing that he vomits a lot, which I got scared, and I had to take him to see the pediatrician last week. He vomits a lot, and then it passes through the nose. And for 3 weeks now, it was like an everyday something.
Okay.
He will vomit in the morning, sometimes in the afternoon, in the evening, sometimes 3 or 4 times in a day. And I was like, I don't understand. I didn't see this with the twins.
Every baby. That's why you see. I was saying that pregnancy is so unique, childbirth and all that. So now, after the pediatrician checked, was there any problem?
No, she said he was fine, and that I should beg him properly.
Yeah, proper positioning when you are breastfeeding.
Yes, so
burping.
I had to teach all those things, and I felt like I didn't even know what I was doing.
You didn't what?
I didn't know what I was doing, like with him, with this new baby. It felt like I'd lost the knowledge of taking care of the baby, so I didn't really know what I was doing wrong or what I was doing right.
Wow. Yeah. So have you been part of it, like a pregnancy class before?
No, I have never been.
Oh, okay, okay. Yeah, so no matter what, I just encourage moms that it is not easy, but then it helps a lot because it's always refreshing because I have had my pregnancy class since 2000, and I've had moms who have been in the class whenever they are pregnant, they come back again because it helps you to get when you have the knowledge, it refreshes you apart from like following the page and all that. Yeah, so for the moms out there, especially first time mom, or you, even if it's your second or third, it refreshes your brain and it helps you have a community of people supporting you. So that is what a lot of like black women, it is something we are introducing, and it is not like it is a want, it is a necessity, to prevent some of the struggles that women go through during pregnancy. But let me also ask, following the page, has it been helpful in any way?
Yes. I didn't join your pregnancy class. When I was pregnant, when I realized I was pregnant, I wanted to join. Then I think you weren't in Ghana then.
Yeah.
Then later, I was like, no, she keeps talking on her page. Why don't you just follow and listen?
Okay.
Then I started following and listening to the advice about pregnancy. Then at least I started knowing that, some of the things I even experienced that I felt like I needed to rush to the hospital were normal. It wasn't something to be alarmed about.
Okay.
But from the beginning, it looks like it's been 4 years I was pregnant. So everything looked so new to me and confusing.
I understand. Yeah. Yeah. I think we have learned a lot from your from this interview. For me personally, I have learned about I think you talk about jaundice, right? The levels of phototherapy, the challenges that you can go through if a woman has who get jaundice, birth asphyxia, coming to delayed speech, and yes, with the current pregnancy, you had all the problems with urine and all those things. Yes, so I have learned a lot. And in summary, what would you say to all women who are listening to you? What advice would you give to new first time moms or everyone who is listening?
I think my advice I'll give to first time moms is that when you are pregnant, try to listen to your doctors or your midwives when they speak concerning things you should do and things you shouldn't do. Okay. Because for me, I faltered a lot. I really faltered. I wasn't listening because I felt like, I'm strong. I can do it. I don't need this medication. I don't need this. But in the long run, it all came back to me, and it affected me and the baby especially. So I would love that they listen to their midwives, their doctors. They should go for regular antenatal checks. And when baby is born, it's feel like you don't understand what is happening to baby. It looks kind of strange, new to you. I think you should seek a doctor's advice than maybe talking to your friends about it or putting it on social media and asking for people's advice. Their advices will not heal that child or heal you in person, but seeking help from a more qualified person would help in a long way.
Okay. Thank you so much for your time. Yeah, so
it's
been so great and insightful. I believe that a lot of people will learn so much from this video. I'm very happy that I had this interview with you. Yeah, so I'll call back, and then I'll call you back. Yeah. So thank you so much. Thank you so much.
Thank you.
Yeah. Bye.
Bye.
No. Yeah. So we have learned a lot from this. I would say that she had gone through a lot of experience, and what I would say is that you will see the good, you will see the bad, and the challenges she went through. Okay, pregnancy class will not take away all the complications, but it will go a very long way to save you from a lot of things. And she mentioned that you should also listen to your doctor, listen to your midwife. Yes, please. I'm promoting maternal health. No matter where you find yourself across the world, I'll give you a call, either on personal call, WhatsApp, whatever channel we can use to have a conversation. I would call you. So please call us. Let us have a conversation about your birth to educate other moms. This is Midwife Sally. You can follow my page, my website, everything Midwife Sally. Yeah. Have a great day and thank you for joining. Bye.